Hello, everybody. Welcome back to the Facts and Fallacies podcast. My name is Cameron English, your host as always. Very excited to be here, joined by Dr. Liza Dunn, toxicologist, emergency medicine physician. Liza, what's going on? It's good to see you.
Not much. It's good to see you. It's been a busy, busy week. How are you?
I'm terrific. I have two young children, so I have bags under my eyes, but that's just par for the course.
I have teenage children, and you can see the bags that I've got. Yeah.
We are once again disrupting our flow of talking about three stories. We can't make up our minds about what we like to do. So we have a special guest this week. I'm talking about Jamie Reed. I'm going to let Jamie introduce herself. Liza and I know your story really well, and I was rereading the article you wrote for the Free Press a few years ago, and I can't get over just how wild this is. So maybe just take a minute or two and introduce people to you if they don't know who you are.
Sure. So I am from St. Louis, Missouri. My background is in cultural anthropology, and I have a master's of science in clinical research management. And I worked at a very prestigious local university hospital system in the pediatric Transgender Center. And in 2023, I became one of the first public whistleblowers in the United States to shed light on some of the horrifying abuses and mistreatment that was occurring within that center here in St. Louis. And within about 6 months, the center was completely shut down, as were most of the other pediatric gender transition services here in the state of Missouri, based a lot in part on that whistleblower and what kind of came forward out of my working in that center.
So, Jamie, when you came to do this, what happened that made you change your mind about this practice and things like that? And I got to tell you, having worked in the same institution, it's a pretty kind of brave step to step out of line with the general persuasion of the administrators and doctors and things like that in a major academic institution.
Yes, so I do think that's a really key element. This is not just a standard kind of hospital setting. When you have an academic medical school that's tied directly to a hospital like this, you really have academics who believe that they are at the peak of their field, that they are very current, that they know the exact science and the medicine and all of the research. This is a research institution. And so, yes, when I became a whistleblower, part of what I actually was really relying on was the ethical training that I got in my clinical training, which was in clinical research, which was in clinical research ethics. A lot of my training was about the history of how medicine has gone terribly wrong in the past. And so I really leaned into that knowledge, knowing that medicine can go wrong, and that when it does, it relies on those internally to course correct and to kind of say, this is wrong and it needs to stop.
But an institution of that caliber can be very terrifying to go up against.
Absolutely, yes. I lost a lot. I moved into a different division and tried to stay. Being a whistleblower is really hard. You get the cold shoulder from everybody. You're kind of seen as that person non grata, which is really hard in an institutional setting like that too. Because, we would have lectures and open kind of forums, and I was just not, my presence was not wanted anymore on campus. So I stuck it out as long as I could. I ended up leaving. I have no regrets. I have some sadness. I did lose my kids' college tuition, and I have 5 kids. So that was a huge kind of loss to our family, but it was the right thing to do. It was ethically the right thing to do.
Mm-hmm.
So I want people to read the Free Press story because it's incredible, but maybe we could talk a little bit about what you were blowing the whistle on. You have cases of kids with severe mental illness who are being prescribed drugs for prostate cancer, and you have clear cases where parents are going, I'm not so sure we should do this. Then you have cases where the parents are divorced, and one goes, this is absolutely not going to happen. And then it seemed, at least from what you were saying, that the clinic was clearly trying to massage things in favor of the parent who was much more sympathetic. So there's these wild things going on. So maybe just give people a little insight into why you felt these were just way over the line. You had to blow the whistle.
Yeah, so this entire field was based on a couple pretty shoddy early studies. So this entire field is based on this idea that if you intervene quickly and early in young children, and that intervening would be to give a puberty blocker, I think that's what you were referring to as those kind of prostate cancer drugs. So a puberty blocker and then cross-sex hormones to children to permanently physically change their secondary sex characteristics to present more as the opposite sex. You cannot actually change anyone's sex, but the idea in this center was that we would intervene for kids who were feeling distress around their gender. When I first started, I thought that we were basing all of these clinical decisions on well thought out standards of care that had been rigorously tested over and over again and had really good evidence pointing that this intervention had good positive outcomes. What I started to see in my tenure, first of all, is that there was no consensus in this field. So even the doctors who were prescribing were all over the place about what they were even doing. Some thought we were treating this mental health condition called gender dysphoria. Some could have cared less if you had that condition. If you claimed that you were trans, and that was good enough for them. And what I also saw was that these written protocols, they were written by this, what I came to find out was really an activist organization called WPATH, the World Professional Association for Transgender Health. These guidelines were not like guidelines you see in other kinds of care. So if you're treating an endocrine condition, if you're treating a kid for diabetes, there's this clear cutoff. You either meet it in the lab values and you get treated, or you don't. And this kind of care was so kind of fly by the seat of the pants, we do whatever we want. So the guidelines would say, don't give this to kids under the age of 16. But if the clinician really feels like you should, and there's special circumstances which nobody defined, go ahead and give it younger. And so we had started it at 16. Within 2 years, we're giving permanent medical interventions to 13-year-old children. And I'm going, well, this is not how guidelines work. This is not how medicine works. You either fit criteria, you fit diagnostic criteria. There's evidence to support if we're changing that. And this was purely ideological. And having come from other sorts of medical divisions, I was just aghast at how truly kind of not scientific any of this was.
There's another surgeon I work with, and in a different context, he's pointed out jokingly that the only person you don't perform a surgery on is the person who wants it. his point is, like medicine is a very careful profession. We move incrementally. We have to think through the long-term consequences of replacing somebody's knee or doing open heart surgery, what have you. And if someone comes in, they're like, "Hey, please cut me up." That's a red flag that you need to slow down, right? But what I've noticed is on this issue, I don't have numbers, but it seems like a lot of healthcare providers, a lot of people within the mainstream science community throw out all of their critical thinking, right? Suddenly this becomes it's a civil rights issue, or it's like a bedrock moral issue. And all of their concerns about evidence-based medicine seem to go out the window. I don't know if you have any insight onto why that happens. Can you speak to that?
It's not even evidence-based medicine that goes out the window. It's common sense. So it's so much of this ideological framework that kind of, it's like glasses that once you put them on, you kind of only see it in this light. And to me, I think in part because of really my anthropology background, I always had this sense of like, you look from a cultural, like things can go wrong, like you question what's going on. And, when I would start to raise those glasses off, all of a sudden I just saw this this doesn't even defy common sense. Um, there is this true belief, and for the clinicians that believe this, they believe that there's this inherent metaphysical transgender soul within these children that they are allowing to be authentic. And there's no way to define that in medicine. A lot of this is also, this is a very weird specialty where the mental health providers are telling endocrinologists what to do.
Mm.
And endocrinologists are kind of saying, well, I don't know anything about mental health, so I'm going to trust you on this. And then the mental health providers were turning to the parents and the kids and saying, well, you're telling us who you are, so I'm just going to believe you. And it was these weird triangulations where nobody was really taking responsibility for the decision at the end of the day. It all just kept kind of circular thinking back to, and when you really got to the end of the day, who was making the decision? This was a child self-diagnosing and in essence self-prescribing. And that defies common sense.
How do you think the medical profession got to this extreme? It seemed like it developed very rapidly, and that rapid onset gender dysphoria for my profession, right?
Yes.
And they've become so entrenched in it that you find very few. It's interesting. You find very few people who are participating in this willing to come on a space or a podcast and with somebody from a different opinion and defend themselves, but they will go after people who disagree with them very vocally. And, even professionals who disagree with them, professionals are getting sidelined at institutions if they say this doesn't fly. Non-tenured people lose jobs and things like that. And so people are very reluctant to sort of poke their heads up. But it's fascinating to me that so many people have been captured all at once in academia.
Yeah, so I think you also saw this period of time too where DEI woke, kind of that civil rights politics had really come into the hospitals overall. So there really was this weird time frame that we were all in where everyone was trying to be the most DEI, the most diverse and equity and inclusion that the system possibly could be. And so for a lot of people, they just saw this as the next frontier, that this was gay 2.0. This was the next way to show that you were the best progressive system that you could be. And the hospitals also were bowing to some outside pressures. So there were equity indexes that were being kind of top-down mandated. I remember being asked a few years into my tenure to help them fill out the HRC yearly equity index. And one of the indicators on there was, do you run a pediatric gender center? And that was a positive score to get a good score at the hospital setting. And then it would be things like, do you have gender neutral bathrooms? Do your staff have pronouns on their name tags? Like these kind of signaling. The whole university, I think, was captured by that ideological sense without pausing.
Was there funding associated with that?
So there was definitely, you could slap that rainbow flag on. You could say that you got the thumbs up approval for the DEI, but our institution had a whole DEI division that they had hired, and that was one of those really large tenor, beliefs within the university setting that had to be front and center in decision making.
Wow.
But before we go on, I wanted to broach something. You're a far right-wing conservative, right? Oh, no, you're not? No. You're just a
No.
normal person with a functioning brain. Okay. Oh,
Uh,
I just wanted to get that out there because one of the things that we get on our spaces almost weekly, because I'm not shy about my opinion on this, and Liza is a little more reasonable, but not shy either. We get the transphobia thing, right? Like you must be a right wing Tucker Carlson addict, and maybe you could speak to the fact that that's absolutely not true, right? There's a very broad base of opposition to what's going on here. So maybe speak to that if you would, please.
yeah, so I am a lifelong super lefty liberal. I lived in an anarchist collective when I was in my undergrad. Um, I'm a lesbian, and my partner at the time that I worked there was also a medically transitioned woman. So she had medically transitioned to male and was living as male for almost 13 years. She has since detransitioned, but no, to me, this has nothing to do with politics. This really, for me, is about medical ethics, science, and also free speech. Like a big part of this comes back to I don't like the concepts around being forcibly silenced, especially in science. Even if you're just waving the flag and saying, hey, there's something here to look at. I'm not even telling you you have to come to the same conclusions I do. But when you see huge shifts in your patient population, that's supposed to trigger at least good scientific curiosity. Hey, why did our patient population explode by 500 thousandths of a percentage? Why are they all teenage girls? Why are they all telling us the same story? That's just basic. That's not
And
politics.
and with the eating disorder epidemic that was around in the 80s and 90s, that question got asked right away. What is it? What is
Right.
the contagion that is making all of these young women think that they are far too overweight? And what is behind that?
Yes.
And people realized it was a mental health issue. And so and I think I'm sort of watching in dismay as mental health programs are getting more and more dismantled, and people with real mental health disorders are sitting in emergency departments for days at a time waiting for some kind of admission. And then when you've got an epidemic of this kind of thing,
Right.
people don't have access
The
to good
floor
mental health care.
upstairs, yeah, the floor upstairs is filled with teenage girls who believe that they're trans.
Yeah. Wow.
Yeah.
Yeah. Yeah.
Yeah.
Uh, Maybe we could talk about some of the tropes that come up with this discussion, which the psychology of this is fascinating to me. So, like when we talk about puberty blockers being reversible, I mean, I guess that might be technically true for certain side effects, but the effects of smoking are reversible if you stop soon enough. So I guess we should be okay with teens smoking, right? And same thing with alcohol consumption. If you stop drinking, before you develop a serious disease, you're fine. Your body can heal itself to a certain extent. But it's only on this issue, right? Like everyone correctly, just so everyone watching, kids shouldn't smoke or drink. I just wanted to, it was just an example, all right? So like everyone in public health thinks correctly about those two issues. But when it comes to this one, oh, it's reversible. So let's just run a real-time experiment because we don't have good clinical data. So we'll just do it now. Talk about that, the
What
reversibility.
we did find though, and the evidence does exist. It's not that we didn't run some studies. We ran some studies, and those studies had really poor outcomes. So this started in the Netherlands. They ran a study. There's a whole bunch about what happened with how they reversed scales and things like that. But the UK did try to do a puberty blocker study, and they buried the results. And the reason why
Wow.
they buried the results is because they had either null or negative findings. And what we know now, even in the US, there is a puberty blocker study that Joanne Olson Kennedy did out in California, and she also has buried the results. Puberty blockers are not completely reversible. They were designed to be used very short term for people with precocious puberty. They were not designed to be used for 5, 6, 7, 8, 10 years by healthy bodies.
And is
And
that, just to clarify, that's how long kids are expected to use them if they go on them for gender affirming care? Or is it,
so,
yeah,
so a
talk
young
about that.
So a young boy at Tanner stage 2 would be started on a GnRH agonist, so a puberty blockade. Um, Boys can start puberty a little bit later than girls. Girls start earlier, but if you're using it for um, gender care, you can imagine a 12-year-old boy is started on that, and we would leave those boys on that GnRH agonist all the way until their mid 20s. Because testosterone is so potent, we would have to keep that down for the feminizing hormones to really do anything to to change the body. So yes, you could see young boys put on this blockade for a decade. The other element with the blockade itself was when it was first attempted as the first experiment, they thought of this as a time to think, a pause, where they could explore more and more in depth therapy to know if somebody really was going to move on and have this lifelong distress. What England found and what we saw in the center I worked at is almost every single person ever put on a puberty blocker goes on to cross-sex hormones. So the thing is that in childhood, you can concretize identities, especially in kids. If you lean into something, kids are so receptive to the world around them. They see, oh, my parent wants this. My parent told the school this. It concretizes these identities. And for so many of those kids, originally we would have seen them desist and no longer have this distress. When we started this whole puberty blocker experiment, it was concretizing and they would go on to have lifelong medical interventions.
How many detransitioners from this particular program have you come across?
While I was still in the center, we started to get detransitioners coming forward to us pretty early on, and a few of them were basically verbally telling us, you heard us, you didn't do this correctly. So we had one who I remember emailed early and said basically, I looked the part, and so you all medicalized me, and wanted to then have, they believed that they had some level of autism, which had led to their distress and that they were not trans at all. We lost to follow up about 30% of the patients that we medicalized.
Wow, that's a lot.
It is an awful lot. And when I would ask the clinicians, do we go find them? Do you want me to look for them? They were like, nope, they're fine. But see, that's what's so interesting to me. Everybody will tell you this is life-saving required care. Yet if somebody tried it and it didn't work for them and they came out the other end, the clinicians know that this isn't life-saving. Like, they're like, oh, it's fine that they no longer are engaged in care.
Wow.
It's my understanding that WPATH and some of the other advocates of this, they're actually quite aware of the limitations of these interventions, and they know the literature really well. And if I'm not mistaken, I think Reality's Last Stand reported on it, but there were emails released where WPATH was saying, we're not sure these kids actually understand what they're signing up for. And that's, I mean, it's a good revelation to come out. But as you said, I think the message that the public gets is, these are reversible. These kids are independent thinkers, and they can, their bodies, their choices. Like, we all know the slogans. But privately, it seems they're telling each other, we got to figure out how to do this because they don't understand the drugs that we're giving them. Can you talk about that?
Yeah, so I absolutely saw that within the center. So part of my training is in consent and assent. And so there's this whole concept around what can a child assent to. And you have to bring the language down. You have to do, I mean, there's ways as physicians, good trained physicians know how to do these things where they have a child do what we would refer to as a teach back. I explain something to you and you just ask the kiddo, like, hey, explain to me, what are you signing up for? And you have to be really good at your job and you listen to see, do they understand? Do they understand the long-term things? And what I just saw so clearly was that these kids do not understand what they're signing up for, especially in regards to fertility and sexual function. So, what the adults in the room know is I'm going to impact your fertility for the rest of your life. And the assent portion, where we were asking the kids to agree with this, basically came down to a clinician saying, hey, do you think you want to have kids of your own? And the teenager saying, oh, no, kids, no. And if I did, I'd just adopt them. As if they didn't even understand what even the concepts around adoption. That would frustrate me as an adoptive parent. I have adopted 3 children out of foster care. I understand the cost of private adoption, the foster care system. They had no idea what they were giving up. They were teenagers basically saying, oh, right now, I don't think I want to have kids. And that was somehow good enough for us to take away their fertility for the rest of their life. They had no idea. They were in that teenage mentality of, I want this today. I need this today. Any delay I can't handle because I have a teenager's brain. And they were not being given. But there's a whole part of me too that I don't believe kids can consent to the loss of their fertility. They're children. They don't understand that conceptually.
I agree. Yeah, I think that, there are so many people who delay childbearing. And you see this often in female doctors will delay childbearing because of their residency, their fellowship, and all of this stuff. I had kids late. And then have a struggle with fertility because of that.
Yes.
And it becomes something that is really, becomes a central focus of their lives. And they are very distressed about not being able to have children.
A 13 or 14-year-old girl versus a 37-year-old woman's consideration of fertility, it's night and day.
It is. Yeah. Yeah.
One other thing comes to mind, and I think you cover this in the story too, and I've seen multiple cases of this online, is you have young girls who transition medically. They have their breasts removed, and then they decide that was a bad idea, and then they want to have kids, but then they can't breastfeed. And I see the experience my wife had with our 2 children, and there's such a unique bond that they have. And I have that too as a father, but it's different, right? And to deprive women of that just strikes me as incredibly cruel. And the weird part is that it's always framed like the people like us are on, like we're the hurtful ones. We don't understand people. So the people that are doing this are claiming the moral high ground, and I just find that mind-boggling. I don't even know if that's a question, but if you have any thoughts.
It's mind-boggling, but it's really challenging. So I count as one of my good friends, Prisha Mosley, who's a detransitioner who did have a bilateral mastectomy, who then went on to become pregnant. And part of this that indicates to me this is still an experiment is when her milk started to come in, her chest wall, she was uncomfortable, in pain, basically had mastitis symptoms with no outlet. They didn't even know what to do with her. They were CAT scanning her chest to try to find out if these milk ducts had any outlet. They didn't even know how to proceed, because the experiment to this was they never thought about, well, what if we do this and this person no longer is trans? They couldn't even comprehend what could occur, and there was no recourse when it did occur. And one of the most heartbreaking things I've talked to her about is it even changed the way that she would be able to cradle and hold her own children. Because as a mom, you have that instinct to hold your child really close to your chest. There's just those bonding elements, and it would cause her pain to do so in ways that nobody had ever asked her or talked to her about when she consented to have her breasts removed in the first place. It should never have happened to her. It should never have been done.
Along those lines, are women who identify as men who wind up pregnant, are they getting continuing testosterone therapy during their pregnancies?
Lisa, that's a great question. So there was actually a really ethically fraught study that was published that essentially argued that it was okay to harm the developing child. We know that testosterone has tetragenic,
Yeah.
yeah, it can lead to differences of sex development and other
Yep.
formations. It was arguing that trans men, women who identify as trans, should have the right to continue on their testosterone treatment if they so desire as their ethical, that they supersede the developing
Baby.
child. Because
And
again, they had never, it never crossed their mind that we would have this absolutely kind of insane social contagion to the point where there are women who are identifying as trans even wanting to become pregnant or
pregnant.
pregnancy.
Yeah.
Part of the concept to begin with.
So, what do you know what the American College of Obstetricians and Gynecology's position is on that?
No. So I don't know that they've actually tackled that, but I do know that there were many, they have taken many positions regarding menstrual suppression, give long-term menstrual suppression to women who identify as trans, young women who identify as trans. They have moved into the hormone business, and there are OBGYNs who do prescribe testosterone, and they absolutely are pro transition.
You know what's mind-blowing to me about this is that the same groups, the American Academy of Pediatrics, which is very pro the transgender medicine, AAP, ACOG, Endocrine Society, will all comment on how, very publicly, on how dangerous trace exposures to BPA, lining baby bottles, or plastic, or
hormones in your chicken.
Hormones in your chicken or in your cattle, right?
Yeah.
Yes, or antibiotics, all of this. How those things will cause endocrine disruption in parts per trillion, and that is terrible. And everybody needs to be sued for that, and everybody needs to, and companies that do that need to go out of business because all of these, this is bad. And then they turn around and promote this and say that you are unscientific if you don't support this. First of all, none of those things cause endocrine disruption in kids, and it's been actually extensively studied. FDA just did a huge study on BPA, in particular, that I guess it got published maybe in 2021. Multiple independent academic centers could find no evidence of endocrine disruption with this. But in the meantime, you've got OBs and pediatricians calling for banning this very well understood chemical because of that. But then they turn around and say, oh no, in this case, it's perfectly okay to give
high doses of
opposite sex hormones and puberty blockers, which are incidentally the same medicines that are given to sex offenders for chemical castration. And you're a heretic if you're a physician and you disagree with this. It's just, people are being literally, or not literally, but figuratively burned at the stake. They're losing their careers because they disagree with this.
Yes. We're in the upside down.
Yeah.
And the fact that it's also interesting to me that the liberal position, the position that, the Democratic position, which has always kind of been more skeptical of, pharmaceutical companies and, utilizing drugs in these fashions, they're the ones that, are promoting this. It's all upside down.
I want to go back to the study you mentioned about giving pregnant women testosterone, because this just absolutely blew my mind. The Conversation, which is sort of like a science popularizer website, they ran an article by the authors, and this headline is crazy. So they say, transgender men and non-binary people are asked to stop testosterone therapy during pregnancy, but the evidence for this guidance is still murky. That's why you don't do it, is because you don't like to your comment about the upside down world, this is science. We don't proceed if we don't have evidence. If it's murky, you stop.
That's right.
And you're
What's
talking
really-
about, sorry, one other thing. They talk about a higher risk for intersex conditions, an increased risk of autism. I mean,
Yes.
you're talking about life-altering changes that these children in the womb are being exposed to.
Supposed to.
Yes.
And what?
So the bigger ethical thing that's being turned on its head, I think, here in medicine is that we went from an evidence-based model, which has not been around super long.
Nope.
I mean,
that took off when I was a resident.
right,
That really,
to be
that's
honest, like,
when it took
the
off.
whole concept of evidence-based is pretty new. But we had this concept of evidence-based medicine. And what I think we're seeing right now because of trans is this shift to values and preferences being given a higher platform. When you talk about those individuals wanting to remain on testosterone, that is superseding the value or preference of the patient. The patient is the consumer. They drive the decision making. We have seen this whole model get flipped on its head where now the consumer-based medicine, the preference of that patient is overriding what we would want to see in evidence, which is directly correct. You know, you're correct, Cameron. If you don't have evidence of safety, you should proceed with caution and assume harm.
That's right.
Yes, but preference has overridden.
It's interesting because some of the studies that I've been reading are like, a statistically significant outcome is not necessary anymore for arriving at a conclusion about a scientific study. If a pharmaceutical company made that claim, they would get just buried. That's not okay. That's not okay.
Yeah. And the position I come from is that people who identify as trans deserve safe, effective, evidence-based care.
Absolutely.
Anyone
Absolutely.
does. Even if you're in mental distress around your sex-based body, you deserve safe, effective, evidence-based care, and that's not what's being provided at any age, honestly.
Yeah. Yeah.
It's with children.
I feel like for the ordinary everyday person who has not spent a lot of time in medicine, not a physician or anything like that, have been blindsided by this, especially if it impacts their children, right? Especially if their children are being put in situations where behind their backs, they're being coached into believing that they're one sex or the other. And the parents have been increasingly separated from that discussion with their children. And so it has fundamentally undermined the practice of the trust in medicine and trust in doctors and trust in our institutions. And for the doctors then to be so surprised by the blossoming of the anti-vaccine movement and the from COVID, if you're an ordinary person and a doctor can convince a Supreme Court justice that she can't tell the difference between a boy and a girl because she's not a biologist.
Yes.
That's completely off the rails. And ordinary people are like, why should I believe anything that you say about vaccines? Or why should I believe anything that you say about medicine? Why should I believe you? And where are our tax dollars going if you can't tell the difference between boys and girls? So I think that the situation that universities find themselves in now and the NIH is finding itself in now is many doctors have not been complicit, but many doctors have just had their heads down and just like, I'm not going to get involved with this discussion because if I do, I've got too much to lose, right? I know I'm an orthopedic surgeon, for example. This has nothing to do with me. But the ones that were more intimately involved with these things really got sidelined by universities. Often this is the younger generation of doctors that are really entrenched in this, and they often have $250,000, $300,000 worth of debt.
They do. You're absolutely right. Yeah.
No outlet. So they're like, I'm stuck. I can't say anything. And so it is an absolute perfect storm for letting very badly intended people run the show,
Yeah.
and it has just devastated trust in medicine. And I'm watching in aghast at what's happened to my profession.
And I love medicine. This is the
Yes, me too.
I grew up, my mom is a microbiologist, worked in a children's hospital most of my life. If you ask me, like, where is one of your favorite places to go? I mean, what kid says, the hospital? I want to go to the hospital with my mom.
Yeah.
But there was this element of, you know, that I felt like growing up, that there's this fundamental truth that still exists.
Yes.
And science and medicine can lead us there. But that means that you always have to be willing to you run a hypothesis, you run a test, and you have to your results that show your hypothesis was
You need
wrong
to.
is more important than when your
That's exactly right.
hypothesis is right. That is what I always loved about science and medicine. And so I don't want to give up on it entirely. I still hope that we can get back to that place where there is the understanding that in our society there is a truth
Yeah.
that sex exists,
That's objective.
that there are objective truths in our
Yeah.
society.
Yeah.
Let me ask you as we wrap up. I've just got this and one other question, but what is the right way to think about these types of interventions? Because Liza said on multiple occasions, there's specific circumstances where maybe you're dealing with an intersex person, where like a procedure like this would be appropriate. Correct me if I'm wrong, Liza. I don't want to speak for you.
Okay.
Okay.
A true intersex person, which
Okay.
is like 0.0015%. Yeah, but yes.
Who has urinary strictures or has
Yes.
or has an endocrine condition that literally will kill them if they will not. Yes.
But that's a vanishingly rare condition. Yes.
So in other words, if I'm hearing both of you right, a healthy 17-year-old should never be subjected to this under any circumstances. Is that fair?
Never.
Yeah, that's fair.
Okay.
Yeah.
Okay. And that goes to the evidence-based medicine thing, which was like there's room for the art of medicine, as Liza put it, right? Like there's doctors prescribe drugs off-label, and they should be free to do that. And there are individual ways that you care for patients. I totally get that. But in those cases, you're trying to remove a disease, or you're trying to restore their health, right? You're not literally chopping off body parts that are functional, which to me is just insane. So maybe that is the distinction, right? It's both the evidence and the intent of what you're doing. What do you think of that?
Yes, I would absolutely agree with you. And what's so interesting is, after I came out the other side and I've read back to where they were at when they came up with this at the beginning, is those ethical questions were being asked at the very beginning. And the conclusion that some came to was, this does come back to, doctors do not have the right to harm a healthy body, nor system, nor physical tissue. And so these cross-sex hormones take a body that's in homeostasis with its endocrine system, and it intentionally destroys or damages that homeostasis. You cannot harm a healthy body is really what it comes back to.
Well, that's the whole basis of the Hippocratic Oath, is the underlying theme is first do no harm.
Yes. Yeah.
So final question, and talk as long as you want. We can go for a while, but I want to be respectful of your time. You're on a bit of a nationwide tour right now. You're testifying in a bunch of state assemblies, state legislatures, either for or against legislation related to these issues. So maybe you could talk about your work. And this is what I love about what you do, is you're actually actively trying to stop what you see as harmful. You're not just on the internet shouting about it, which is effective too, but you're actually going in front of lawmakers and you're saying, hey, you don't know what's going on here. Let me inform you. Tell us a little bit about that.
Yes. So it started here in Missouri first. And I will say, when that free press story came out, my intention behind that was, I literally just thought that the center where I worked at needed to be stopped. It has now been about 2.5 years, and that trajectory has just increased to the point where I now understand that the entire system and all of the centers within the U.S. who are doing this are harming young people, that the protocol itself is based on poor evidence that harms people. And so I do believe that it's part of my responsibility to make things right. I participated in those harms for almost 5 years. And part of what I can do to make that right is I can bring the expertise and the knowledge that I know to lawmakers. And a lot of times it's simply you're given about 2 minutes to testify, and I'm there just to answer questions.
Mhm.
And part of what has gone so wrong is that our lawmakers have not been given a lot of the actual the truth. And so a
Right.
lot of it is just being there to answer questions, to have conversations. Um, I absolutely support restrictions on these medical interventions in every state and support stopping puberty blockers, cross-sex hormones, and any surgeries from being done to children at this point. And unfortunately, I've come to the conclusion that the medical institutions are not going to correct the course on this themselves, that it has to come down to laws.
What's amazing about your story is that you were able to reflect on something and go, oh my gosh, I was wrong. And that's incredibly rare for people to be able to do that. Now, the doctors who are actually prescribing these medicines and doing these surgeries have taken it even one step further and have been, I think if they're reflecting back on what they've done wrong and the consequences that has had on, at this point, thousands. Do you have the number of children off the top of your head by any chance?
In my own center, I saw close to 1,500 unique children.
So that's in one institution, and we're talking about there are 100 different
Yeah.
institutions across the country. So thousands of children. um, the impact that that's going to have. People are going to look back at this time once the dust has settled and say, "How was this possible? How did we have such a widespread um, evil? How was this possible?"
Yeah.
And how is it possible that so many people got brainwashed enough? And this kind of thing happens over and over and over again. We did it with lobotomy. And lobotomy was actually, I mean, before lobotomy, violent schizophrenics were often chained to walls because,
Oh, they were also ice bathed. They were
yeah,
put into diabetic comas. They were given high doses
all,
of insulin. We
yes.
tried all sorts of things.
And so lobotomy seemed to be a decent intervention, right? And it wound up being taken up by all sorts of different things, and it was bad. And thank God they found neuroleptic drugs to control symptoms of schizophrenia and manage people in a much more safe way. But lobotomy was like a last ditch effort to kind of calm some of these folks down. And in retrospect, it had devastating consequences. This doesn't even have, in my mind, that level of precondition.
Yes, I see. And part of that is in medicine, when you know better, you do better.
Right.
And so I might not have been the surgeon implanting the puberty blocker, but I was in the same day surgery room. I was holding that kid's hand, and
But you thought you had the evidence.
I thought, yes.
And then once you explored the evidence, you realized it wasn't there.
And just seeing the patients in front of me too.
Yeah.
It's not just it's the data set. It was the data set for my own patients, but it was literally seeing the patients in front of us not getting better.
Yep.
They were not getting better.
And then the subsequent surgeries that people go through, if you have a micro penis because of puberty blockers, you're not going to have enough tissue to actually do the surgery that opens up your pelvic floor, and you are at risk for permanent incontinence. I mean, all sorts of complications with this stuff. And there was an 18-year-old kid that they used part of his colon to make a neovagina, and he wound up dying of sepsis
Yeah.
because he got infected. It's, this kind of stuff is it's unfathomable to me that real physicians are participating in this.
Yeah.
I was going to ask as a final question, if you have time, that is. I don't want to keep
Yeah.
you.
Go ahead.
It seems that people like the activists and a lot of the lawmakers, the people pushing this, basically, they're very eager, it seems, to keep the parents at arm's length.
Yeah.
Like either the parents are all in, which is fine, or they need to be kept as like we'll let you know when things are good, but this is not your child anymore, effectively. But as I'm here, Liza, describing the complications and how these procedures work, I kind of think that's why. Because if the parents really understood what goes on and what the risks are, they would shut this down. Like this wouldn't last another week. But I think because yeah, go ahead.
Yeah,
Go ahead.
I actually think this brings you full circle right back to the very beginning, which was when a parent brings a child to a prestigious institution. In my city, this is the best children's hospital you can possibly bring your child to. If my kid was in a car accident today, I would say that's where you need to bring them. So these parents still have a level of trust. They did have a level of trust that you are diagnosing my child with something and this is the only way to cure them. And they had that. I spoke to a few grandparents who were really skeptical. And when I would say, back when I still worked there, oh, but it's at St. Louis Children's Hospital, they would go, oh, okay, well, yes, that's the best institution here. I guess this makes sense. Parents believed us. And so there is a small set of parents who I do think were totally bought in and they pushed this on their kids. But there was a whole lot of parents who were simply lied to and who did what they thought was best at the time. And some of them are too dug in to walk back.
Yeah.
But some of them, I think, also have to reckon with that pain that
Yeah.
they were lied to.
Brutal. Brutal. This
What do you
is
think?
so heavy.
It is. What do you think I know you're doing legislation. What do you think the outcome's going to be?
Oh, my hope is that we're going to see every state in the United States restricting no child should be given a puberty blocker, cross-sex hormone, or surgery in the United
And I
States.
feel like it's starting to go that way.
I do too, but this is not going to be easy.
Yeah.
We have this institutionalized across most of the Western English-speaking world. This had really spread and been institutionalized, and we are having to chip it and pull it back in
Yeah.
so many places. It's not just medicine; it's in the schools, it's in the
Yep.
sports, it's in our law. I unfortunately think I'll be in business doing this for the next 30 years.
Probably.
Wild.
And if we're wrapping up, the organization that I started, basically it's the LGB Courage Coalition. I don't testify alone. I testify with a whole group of detransitioners, parents, other adult gays and lesbians. And we work every day basically to educate the public and to educate lawmakers around this topic.
Just as you said that, I feel like, there was this whole discussion in the 50s and 60s and 70s about converting gay children by psychiatric care, and the whole process that they use. And I feel like this is this is a much more extreme version of that.
Yes, it is. Absolutely. Right behind me is most gender nonconforming kids grow up to be gay. And if they would have been left alone, but now they've been transed. And so, yes, we absolutely see this as an attack on letting gays and lesbians be whole, healthy people.
Right.
Yeah.
Okay, so I think you guys run a Substack,
We do.
excuse me, so we can send people there, and then your handle on X is at Jamie
Amy
Whistle.
Whistle.
Nice and simple. Is that the best place for people to go to follow your work?
Yep.
Okay. Okay, awesome. Well, let's wrap it up there. We've been going for a little over an hour because we both got into this. So okay, so go follow Jamie. Follow us as well. It's at Dr. Liza MD. I'm at Cam J English. Thank you so much for doing this and for all the work you're doing. It takes a lot of courage, as I think you've been told. And
Figure it out.
Yeah, you know from experience.
Thank
No
you
doubt.
so much for having me today.
All right.
Yes.
See you guys next week. Thank you for joining us, and until next time.